My dad passed away fall of 2019. So my New Year's resolution was in 2020, I was going to make all of my doctor's appointments that I have not been to in years.
And lo and behold, when she had a CAT scan of the chest, a nodule was found.
Then I was put in touch with Dr. Stewart and Kevin Dubree, and they have been following me ever since. And every year I keep going to get a CAT scan, and this past year it grew. So I had to have a PET scan and then another biopsy, and that's when they said it was lung cancer.
Oftentimes people come in to see me, they're extremely anxious, very worried, very concerned, thinking they have a death sentence, and that's not true. Especially now, we're catching people with their lung cancers a lot earlier. Our treatments are getting better and better and better. We can treat this and we can beat it, and you can live a normal life afterwards. You know, if you run marathons, you can continue to run your marathons. If you like to garden, go ahead and garden. If you just want to run around with your grandkids, you'll be able to do that afterwards. And it's great to be able to offer that to patients.
Dr. Stewart said that they could leave the tumor there because they are very slow growing, but because it has grown, and I guess with my age, she thought best that we remove it. So I had the surgery to have the upper lobe of my lung removed.
During the operation, Dr. Stewart and I used the surgical robot, which gives us a degree of precision and visualization that we wouldn't otherwise have. So it allows us to see structures more clearly, move the instrumentation more accurately, really dissect out the anatomy that we need to in a much more precise fashion than we used to be able to do before the robot was created.
There's many questions that come with the robot. Does it work itself? What does it look like? It's just a tool. It's another instrument for me to use to treat our patients. So when we do robotic surgery, we do small incisions in between the ribs. They're usually about this big, not much larger. One is for a camera, and the other ones are for instruments so that I can do the work that I need to do. The reason why I like robotic surgery is typically there's less pain, less blood loss, and the return to work is usually fairly quick when you compare it to open surgery.
I was very happy that I did not have to travel far to get the care that I needed to get. I was quite fortunate that I turned out to be, in the best hands, and I had the best care, and I'm now cancer-free.